am here today to ask for your support for Assembly Bill 241. AB 241 would reduce disparities in healthcare by requiring continued medical education courses to include curriculum on implicit bias for licensees under the Medical Board, Physician Assistant Board, and the Board of Registered Nursing. Implicit bias, the attitudes or internalized stereotypes that subconsciously affect our perceptions, actions, and decisions, exist and often contribute to unequal treatment of people based on race, ethnicity, gender identity, sexual orientation, disability, and other characteristics. Racism, sexism, isms do not equal bias. We all have unintended biases without realizing. Even when we wish to treat people equally, ingrained stereotypes can affect our perception, our memory, and our behavior. In healthcare, implicit bias particularly can threaten the lives of patients. Medical professionals constantly make rapid decisions under stressful conditions that may alter the lives of their patients. For example, studies have shown the following. Women are more likely to survive a heart attack when treated by a female physician. Black patients often are prescribed less pain medication than white patients who express the same complaints. 18% of people who identify as lesbian, gay, bisexual, trans, or queer avoid doctors' offices for fear of discrimination and provider bias. Latino men in California are 21% less likely to receive the best treatment for high-risk, localized prostate cancer than white men, and African American women are 243% more likely to die from pregnancy or childbirth-related causes than white women. These are just a few of the many statistics that demonstrate how bias, whether explicit or not, affect the way healthcare providers treat patients different from themselves. We cannot just wait and hope that these numbers can improve, especially when lives are on the line. Leaders in medicine, including the American Academy of Family Physicians, the Mayo Clinic, Kaiser Permanente, and Vanderbilt University Medical Center, increasingly are urging medical professionals to learn about personal bias and strategies to address biases in an effort to create an environment that offers equal treatment to everyone. Our medical community right here in California should be at the forefront to improve treatment and outcomes for patients who have been underserved by their healthcare professionals. AB 241 takes a comprehensive preventative approach to reduce disparities in healthcare. I have two speakers here to testify, Dr. Piri Ackerman-Barger, Assistant Clinical Professor at UC Davis's Betty Irene Moore School of Nursing, and Kimberly Papillon, attorney and nationally recognized expert on medical, legal, and judicial decision-making.
Great, thank you very much. Up to 3 minutes in total for your testimony.
Okay, thank you. Health disparities are very well documented in the healthcare literature. They are pernicious and ongoing. Some further examples are that Black and Hispanic patients are less likely to receive analgesia than white patients when presenting with the same symptoms, and this was true for Black and Hispanic children as well. LGBT patients are under-assessed, under-researched, and healthcare topics related to this community are often avoided by healthcare providers. Unconscious bias in healthcare providers can lead to health disparities such as inadequate treatments of conditions like pain, obesity, cardiovascular disease, asthma, and mental health. Not only does unconscious bias contribute to undertreatment, but studies have shown that providers with more implicit biases are more likely to have negative interactions with patients. This impacts the trust that patients have in healthcare providers and the likelihood that patients will seek healthcare. The paradox with unconscious bias is that the things that dwell in our unconscious are not necessarily in alignment with our personal values. This means it's not necessarily a group of bad providers who are responsible for health disparities. Rather, it is likely that it is a collective issue that includes caring, well-intentioned providers who, at times, are making healthcare decisions based on bias rather than standardized care. This most likely happens when providers are tired, uncertain, overburdened, or have multiple demands to their attention. However, unconscious bias can be mitigated.
Good morning, Chair and esteemed members. Thank you for inviting me. My name is Kimberly Papillon, and I am a judicial professor who teaches on the neuroscience of decision-making to judges and physicians primarily. What we found beyond the conversation around simply does implicit bias exist is this absolutely extraordinary discovery that there are neuroscientific correlates that we can actually identify that determine how decisions will be made. And what is even more important is that we've been able to identify specific interventions that can be communicated through training that will lower one's level of implicit bias specifically, that will change the neurophysiologic reactions of the brain so that people can make fair decisions in the face of bias, and that will lower specific neurophysiologic reactions that we have particular concern about with physicians. If you have a high level of implicit bias, for instance, towards African Americans, the part of your brain that activates when you see a spider or a snake will be more likely to activate when you see someone who looks far more like Shaquille O'Neal than Matt Damon. Imagine yourself as a physician walking into an examination room and feeling as if you've just seen a spider or a snake when you interact with your patient. Also important is that the level of implicit bias can predict the level of pain empathy, physiologic pain empathy. How does that affect a physician's ability, a RN's ability, a PA's or NP's ability to actually effectively treat and empathize with patients in their time of need?
Thank you. 10 seconds
We
left.
know that training can specifically alter these brain reactions effectively and therefore increase the level of equity in healthcare in the state of California. Thank you.
Thank you very much. Any additional witnesses wishing to speak in support, simply name and affiliation if you wish to do so.
Mr. Chair and members, Betsy Armstrong on behalf of the county health executives and urge your support.
Jimmy Fremgen, Disability Rights California, in support.
Becca Kramer Matter, ACLU of California, in support.
Angela Williams, California Black Health Network, in strong support.
Christina Boss Hamilton with UDW AFSCME in strong support.
Deanna Gallegos with the UC Student Association in strong support.
Molly Robeson with Planned Parenthood Affiliates of California in strong support.
Morgan Carvajal with the California Medical Association. We appreciate all the work that the author has done on this bill and feel like it's a balanced approach for physicians. We're neutral. Thank you.
Thank you very much. Any additional witnesses wishing to speak in support? Seeing none, any witnesses in opposition? Any witnesses in opposition at this time? Seeing no witnesses in opposition at this time, questions or comments from committee members? Any questions or comments from committee members at this time? First off, Dr. Eggman, followed by Mr. Gloria.
Thank you for bringing this forward today. And I know there were still some things that are still being worked out, but I would like to move the bill. I think this is an important thing as somebody who taught. I know it never hurts to be able to look at ourselves a little bit more, to be able to, and not just in our practice, but I think in our personal lives and just how we interact with the world in general, to be able to dig deep and look at all our implicit biases is important. I just think for humanity and for us to keep going forward. So I'd like to move your bill.
Mr. Gloria.
Thank you, Mr. Chairman. I just want to thank my colleague as well for bringing this bill forward. A lot of your testimony and the testimony of your witnesses resonate for me in my own lived experience. I recognize this may not be every member's experience in the doctor's office, but many of us know exactly what you're referring to, and to the extent that we're providing education to medical professionals, I think this is so important. So thank you for bringing this forward. I'm happy to second the motion.
Thank you very much. Any additional questions or comments from committee members at this time? Thank you very much. Seeing none from other committee members. Assemblywoman, I just had a few questions with respect to the conversations that we've had since the committee's recommendation and moving forward on sort of the implementation issues and your commitment in trying to accommodate and address some of those issues, understanding the legislative intent to the essence to what we're trying to get at, but oftentimes in the bureaucratic nature of that of the state of California, how we can actually implement that. So might you be able to help address some of those issues with respect to the issues and that have been raised?
For your work on this bill and for the great work of your committee staff. Implementation is incredibly important. I am running as there are 3 bills. It's a companion. There are companion bills to this that talk about implicit bias in areas where one's life and death are at stake. And we have been working with all parties to talk about implementation. And in fact, I think the fact that 2 out of the 3 groups that are touched by this bill have worked with us to address implementation concerns and either have not had opposition or have removed their opposition from this bill shows that we are committed to making sure that this is not a sugar-coated kumbaya bill, but something that is substantive and that will help us as a state acknowledge implicit bias in areas, like I said, where one's life or death are at stake. And I believe that, you know, it's one thing to kind of talk about policy, and then it's another to work with the technocrats to really make sure that you have an implementation and a process that is meaningful, but is also frequent and beneficial.
Wonderful. Thank you very much for addressing that. As you and I have spoken, there were some of those initial conversations with respect to the implementation, but yet understanding the key essence of the intent and addressing this very pervasive issue. So I commend you very much for helping to accommodate and asking the legislature to address this issue in a deliberative fashion. And so with that commitment that you've made here today, this does now enjoy a do-pass recommendation as well. There's been a motion and a second. Committee Secretary, would you please call the roll? Gloria Nick.
AB 241, motion is due pass as amended to appropriations. Low?
Aye.
Low, aye. Bro? Bloom? Chen? Chen not voting. Chu? Cunningham? Dolly? Dolly not voting. Fong? Eggman? Eggman, aye. Fong not voting. Gibson? Gloria? Aye. Gloria, aye. Grayson? Holden? Irwin? Irwin, aye. McCarty? Medina? Mullen? Obernolte? Obernolte not voting. Quirk Silva? Ting.
That bill has 4 votes. We'll leave the roll open for absent members.
Thank you, Mr. Chair. Thank you, members.
Thank you very much.